to try to encourage doctors to use telehealth. There are some incentives, some initial money, $6,000, then it's reduced in subsequent years and it's going to cut out after 2014. And the consultation itself is approximately 50% more than a standard consultation. So these are some incentives to get doctors on board for this. At the moment, about the rough figures, it's not known exactly, but about 70 to 80% of these telehealth consultations occur through Skype. So how are we being pushed forward? Well, partly by government, semi-government organisations such as NETA, and NETA has responsibility for a number of things which are listed there. The problem with NETA is that it doesn't have a lot of money and it doesn't have much legislative clout. So it can provide suggestions for example, the adoption of standards for secure messaging, but it can't legislate for that. So in many cases, they are not actually adopted. The government tries to lead the doctors by dangling some money in front of them, and the latest, there's been a series of these sort of e-health practice incentive program dangles of money. The latest one involves these 5 items. So doctors have actually uploaded their own individual and practice health identifier numbers. They're using secure messaging by having some software in place that does this. They are using, perhaps not clinical coding strictly, although that's what's listed. They're using the terminology provided by the software to put a label to the reason for the encounter, that the electronic prescriptions are in place, and that they have they're ready to do personally controlled electronic health records and just waiting for patients to register. So they get a bit of top-up money. Most of our money is fee for service, but that does encourage GPs to do this, because why not? You get a bit of extra for it. Government's also been involved in a number of sort of projects over the last 10 years. These are 3 of the major projects, and like most projects, they're good while they last and while there's some money there. Most of them, each of the programs there have had individual projects funded within them, so that a project might go for a year. It'll work quite well to improve communication between different sectors of the health services, but when the money runs out, then the project tends to die. So perhaps there were some lessons learned from these projects, but in terms of sustainability, they were not all that successful. The College of GPs also provides support by providing some guidelines for example, in telehealth, as to what's an appropriate consultation. They provide guidelines for computer security and try to provide education, for example, about the PCEHR with various webinars and live demonstrations. And of course, private industry also does some advertising and educates GPs about what's available. So, using the Australian example, I think that from my take of the lessons are that the first step is to get the computer stuff on your own desk right. The next step is to start connecting to computers that are outside your own practice. The government can have a role by providing initiatives or incentives for GPs and can fund programs that perhaps might not just take up by themselves, particularly telehealth, which I think is an advantage for rural areas. To have some projects to sort of tease out what to do. For example, there were many and remain many concerns about patient privacy with these, particularly with the shared electronic health record, and some of the projects perhaps did provide some lessons about how these can be, privacy can be better catered for. And so slowly over the years things do seem to be moving in a forward direction. So what's the lesson for you? Well, the lesson, as far as I can see, is that you have to learn your own lesson, because it'll depend on which stage you're at, how much money you have to invest in certain things, and people have sometimes thought, well, look, if only the government would fix the problem, like the United Kingdom apparently tried to do, then that would be good. I mean, one of the things that we lament in Australia is that there's no legislation of enforcing standards, which is a real problem in terms of interconnectivity. But the problem with the top-down approach, of course, is that you can invest millions, but you go off in the wrong direction. Just leaving it to private enterprise, the bottom-up approach doesn't seem to be highly effective, as the Americans have found out. And so Enrico Corriera has coined this term, the middle out, instead of top-down or bottom-up. You have a combination of both government and local bodies trying to make advances in the use of computers. So, there's some of the states of progress in Australia, and I'll be happy to take a few questions, and then we can perhaps have some discussion about what's happening in your country. And in the end, I'd like to perhaps bring this back to, this is a presentation on behalf of the Informatics Working Party, to bring it back to what some of the things that perhaps the Working Party can do to try to promote the better uptake of and use of computers in medicine. So first of all, some questions about